YouTube channel Ask Your Gynecologist. So today we have come back with the same series, how to get pregnant, and today is tip number 7, that is 7th part of this video. In the last 2 videos it was dedicated to the male partners because we discussed abnormalities in the semen reports, and in the next video we discussed what all are the causes which causes a bad semen report. So today I am just going to touch a very simple topic, why so many tests are done when an infertile couple walks into the clinic. Because many patients, including my patients, they complain, why so many tests? Suddenly they think that, oh my god, how much we are spending on the tests. But these are very important. So that is why I thought I should make this video. Okay, so before I start, I would just tell you that DocWise app has picked up very well. Every day so many patients get connected. I feel connected to almost patients all over the world because they send me reports, I send them prescriptions, and it is very easy to communicate. It is just like WhatsApp. You can send your reports. I can call you if you have a national, that is Indian number. I cannot call you on international number, but we can exchange voice messages and I can send you a prescription. Okay, apart from this, I have started a new live session which is called Super Chat on this channel. This is to help you all. YouTube has basically decided how much amount you have to pay using your debit card or credit card. So every Sunday for around 10 to 15 minutes, I select a small topic, I talk on that topic, and during that session, if you have any question related either to that topic or any other topic, you can just pick up your debit card and type your question, and the YouTube will tell you how much you have to pay. It starts from very minimal amount, rupees 40 Indian rupees, and then it can go up to any amount depending upon the type of question you're typing, right? So the good thing is that as soon as that question flashes on the screen, I can see it because it comes in a green color, and then easily you can get the answer there and then. You don't have to wait for the next day or the next Sunday. Okay, there is another channel that I have started for people who are watching this video for the first time, that is Dr. Sonal's Answers. Because Ask Your Gynecologist channel has picked up so well, there are so many questions every day so many people see different videos. There are more than 250 videos, and on every video I get comments. It is very difficult for me to gather all the questions and answer them. So I started with a new channel, Dr. Sonal's Answers. So any question that you have in your mind, you can post there and you get answer on the next day. Because every day I go live, I do not answer your live questions, I answer the questions which you asked the previous day, because live questions are too many in number. They're almost 150 to 200 questions. So the next day I just screen those questions, I select the questions which I feel are important for other people as well, the general questions. So I select those questions, I give you answer free of cost. In there, if you are posting some personal question like your report or about your husband, your children, or your personal problems, then either you come on DocWise app because that is the best platform. If you think DocWise app is not being supported by your mobile, you're not able to get it, you're not able to understand it, the other 2 options left for you is, one is Super Chat. You can wait for the Sunday and you can post your question there with the payment and you get the answer there, then and there. If you cannot wait till Sunday and you need an urgent answer, then you have to pay just 100 Indian rupees through Paytm on this number. This is the number on which you can do a Paytm. As soon as the screen shows that the payment has been done successfully, take a screenshot, send it on WhatsApp on this number along with your question. So as soon as I get this question through my secretary, obviously this number is of my secretary, do not call her. Please do not call her because she is not the one who is going to give you answers. I am the one who will be answering your questions. So you do not WhatsApp your problems to my secretary. Just do the Paytm, take a screenshot, WhatsApp the screenshot, and then WhatsApp your question. That question will come to me and I will automatically answer it in the live session, right? So coming back to the topic, what all investigations have to be done whenever an infertile couple walks into the clinic, okay? Coming to the male partner first, because the only test that we do in a male partner is a semen analysis. In case the semen analysis report is bad, it is abnormal, then we go for other tests like blood tests or even sometimes a biopsy of the testes. We have already discussed this in the previous 2 videos of semen analysis. Now coming to the female, now I divide the female blood tests in 3 parts, right? So coming to the blood test first, one is a general blood test which decides whether you have the immunity to fight infections, whether you have a proper hemoglobin, you're strong enough to hold a pregnancy, you're not weak in anywhere in your vitamins or in your hemoglobin. The other one is infection testing, and the third one is hormonal testing. Coming to the general blood test, that is complete blood count, that gives an idea about your immunity, your hemoglobin, the TLC, DLC, blood sugar. Blood sugar is very important because you all know if you have diabetes, it will be difficult to conceive, as well as it will be very dangerous for you to conceive during an uncontrolled sugar. right? And it will be very lethal for your baby as well. Blood group, because we know that if the blood group is negative and the husband is positive, then when you conceive, there will be a problem. There will be no problem in conceiving. So blood group is not a very urgent test, but it comes in the general category test. You should know your blood group. Coming to the infection testing. Now, infection testing, as I told in my video, in which we discussed what all lab reports, what all blood tests are done during pregnancy. Again, pregnant patients, sometimes they do complain, why so many tests, ma'am? I have no problems. Why you are writing so many tests? Well, there are certain tests that are very, very important for pregnant lady. Similarly, those infection testings are done in an infertile couple as well, because these infections, first of all, they will lower your immunity. So obviously your chances of getting pregnant will be low. They sometimes might hamper your tubes. The environment inside the uterus may not be good enough for you to conceive. You might have abortions. And in case you conceive with this infection, your baby might suffer from this infection and can get congenital problems. Okay, so these are the tests which I am just discussing. VDRL, which detects syphilis, which is a sexually transmitted disease, HIV and HBsAg. Now these are the tests which we have already discussed before, so I am not going into the details. There is another test which is very important for a pregnant lady, which not many doctors are doing, but you should request your doctor to do, especially if there is a problem in your tubes, and that is chlamydia. Now chlamydia is a bacteria which is not detected in any test. We cannot detect in torch. We can only detect it by doing a high vaginal swab. A high vaginal swab or an intracervical swab, which is a very small, very simple test. It is not painful at all. It is just a cotton swab which is moved in your vagina and inside your cervix, and it detects the infection. Okay, so in case you have a blocked tube, then the test that we should do is tuberculosis. Tuberculosis I have not discussed here because we have already discussed that before. Tuberculosis, the video on tuberculosis has already come, right? So tuberculosis and chlamydia are the two major factors, major infections which cause blocked tubes. Okay. Next, coming to the third category, that is hormonal blood tests. Now, hormonal blood tests, the most important ones are thyroid, TSH, which we have already discussed before. So, if you have thyroid, then obviously whether it is hypothyroid or hyperthyroid, your ovulation will be hampered. It will be difficult for you to conceive, and if you conceive, either you will abort or your baby, the baby which is developing inside you, will develop thyroid problems. Right? So thyroid is very important. The next hormonal test that we do is prolactin. If prolactin is high, then your ovulation will be hampered, and obviously it will be difficult for you to conceive. Third is AMH. AMH we have already discussed in the Sunday session, which was the first video that I made on the basis of super chat. So we have already discussed AMH, that is anti-Mullerian hormone. Anti-Mullerian hormone will basically detect how many follicles your ovary is producing and how many, what is the body's capacity of producing eggs. So these three hormonal tests are very important. Sometimes, rarely, we will do estrogen and progesterone testing on day 2 of your menses. Generally, this is done when we feel that there is a deficiency of estrogen, or in PCOD patients where there is a deficiency of progesterone, too much LH, too much estrogen. In such cases, they have a tendency of either having a luteal phase defect, which will lead to either hampered ovulation or which might lead to abortions later on. So these are certain tests that we might do on day 2, but TSH, prolactin and AMH, I do it routinely. These are the blood tests. Next, coming to tubal testing. Now, before tubal testing, we do a routine ultrasound on every patient. Ultrasound, it is just like a shadow, black and white shadow. If at all we add color to it, we make it a colored ultrasound, then it just detects the veins and the arteries. It just detects the blood flow. So basically it is a indication of whether the endometrium is normal, the thickness is normal or not, the uterus volume, the uterus shape is normal or not, the ovaries are normal or not. If there is any mass or fibroid, then we can detect. Cysts can be detected. But what we cannot see is the tube. Tube is a very thin thread-like structure. It cannot be seen on ultrasound. So the only way that we can detect tubal problems is either HSG or SSG. HSG stands for hysterosalpingography and SSG stands for sonosalpingography. What is the difference? In both the tests, there is a little bit of pain because it involves certain 10 to 20 ml of drug which is passed through the vagina, through the cervix into the uterus. It is injected in the uterus, and then that medicine has to come out through both the tubes in your tummy. So we see that drug, that particular liquid coming out from the tube into your tummy, either on the basis of X-ray or on the basis of sonography. So that is why either HSG or SSG. Both are just 5 to 10 minutes procedures, and they can give an indication on a very broadly speaking, I mean, it is not very diagnostic because it does not give us the anatomical picture. It just tells us how the the drug is traveling through your tubes and whether it is coming out or not. Sometimes it might even give false negative reports, like for example, sometimes if the operator or the person who is injecting the drug is not doing it properly, if the drug is leaking back, it is coming back, or because of pain you go under a spasm, because of that the tube kind of closes its ostia, the holes, and the report comes that the tubes are blocked, but sometimes they are not. So what is the gold standard? The gold standard test would be laparoscopy. That is a small keyhole surgery. We just make 1 centimeter incision around the umbilicus and we go inside with the camera and we see the entire thing inside the abdomen on the entire picture of your uterus, the tubes and everything else on a screen. Right? So that is the gold standard thing, but we do not jump into laparoscopy because it is a kind of mini operation, kind of invasive test, and if you think that it is just about 1 or 2 years that you have been trying for a pregnancy, then we can probably wait for before we do this invasive test. So in case your HSG or SSG report comes back abnormal, then to diagnose and to confirm that yes, there is a problem in the tube, and sometimes it can even be corrected during laparoscopy. So laparoscopy is done as a second step procedure. And I personally, if I talk about myself, whenever I do a laparoscopy, I would always combine it with hysteroscopy. Hysteroscopy means picture of the uterus. We do scopy of a uterus, and that is again a very small thin camera, just like a pen-like camera. It goes inside the vagina, through the cervix, goes inside the uterus, and we take a picture of inside the uterus, and then through laparoscopy we take a picture of outside the uterus and the tubes and ovaries, right? Sometimes many doctors, even including me, would do a hysteroscopy along with HSG. So whenever we take you to the X-ray room, we can do an office hysteroscopy without giving you any sedation or anesthesia, and along with that we can do a HSG. So basically we are testing your uterus, the inside of the uterus, as well as the ostia, the openings of the tubes, and then the tubal, whether it's open or not, the tubal patency. The patency of the tube is checked by HSG. So these are the tests. Now hopefully you will not question your doctor why so many tests are being done, doctor, on the first visit, because blood tests, they have a different importance, sonography has a different importance, and the HSG, SSG, hysteroscopy, laparoscopy, they all basically have different reasons why they should be done, and they detect different parts of your reproductive system. So in case you have to ask your doctor, what is the problem with me? How will the doctor tell you unless and until we do the entire test? Okay, so go ahead, go to your doctor, and whenever she does the test, don't question her because she knows what is the best. So if you like the video, please press the like button, share my video, subscribe to the channel, and thank you very much for the tremendous response that you people have given to this channel. Thank you very much. Bye.